Welcome to Kangaroo Care Women and Children Hospital. This is a doctors-driven hospital. Equipped with cutting-edge technology, Kangaroo Care Women and Children Hospital.
Hi, I am Dr. Chaya, Obstetrician and Gynecologist, Consultant Laparoscopic Surgeon in Kangaroo Care Hospital, Bangalore. Today I will be speaking about endometriosis. What is endometriosis? Endometriosis is a condition wherein the tissue similar to the lining of the uterus is present in areas outside the uterus and in other parts of the body. So why does this endometriosis occur? Before we go into the detail, let us recapitulate what happens in a normal menstrual cycle. The female reproductive system consists of the uterus, fallopian tubes and the ovaries. The ovary secretes various hormones. So the inner layer of the uterus called the endometrium responds to these hormones and they thicken. This is to receive the fertilized egg for implantation. In case the implantation does not occur, the thickened endometrium sheds through the vagina as blood and menstruation occurs. So this is how the menstrual period occurs every month. So in endometriosis, what happens is the misplaced endometrial tissue which is present in other parts of the body also respond to the hormones secreted by the ovary in a similar way the endometrium would. The misplaced endometrial tissue also thickens and it also bleeds every month, but this doesn't have an outlet to go out of the body. As a result, it forms cysts and it forms lesions called as endometriosis. So which are the common sites of endometriosis? Endometriosis, the most common site is the ovary, fallopian tube, the inner layer of the pelvis called the peritoneum. It can also occur on the bladder, rectum, intestines. In endometriosis, which forms in the ovary, is called as endometriotic cyst. Endometriotic cysts are fluid-filled cavities which occur in the ovary. As a result of this endometriotic cyst, adhesions form. Adhesions means band-like tissues which cause organs or surfaces to stick to each other. Endometriotic cyst gets adherent to the posterior surface of the uterus, or two cysts can happen in both the ovaries and they can get stuck to each other, which is called as kissing ovary which appears as a radiological sign. So what are the symptoms of endometriosis? The triad of endometriosis is dysmenorrhea, dyspareunia and infertility. Dysmenorrhea means painful periods. So patients complain severe pain during their periods. They also have painful bowel movements, painful urination during the periods. They can also have chronic low-grade irritating pain throughout the menstrual cycle. And the most important thing why patients see the doctors or how endometriosis is recognized is because when they consult the doctor for infertility. So why does infertility happen in endometriosis? Because of the endometriotic cysts and adhesions, the normal tubo-ovarian relationship is altered. As a result, infertility occurs. So how is the endometriosis diagnosed? It is usually diagnosed through a ultrasonographical examination. So how do we treat endometriosis? Treatment aspect is relieving the symptoms of endometriosis. The more commonly used medicines are the analgesics to relieve the pain during the periods. Then we do use hormonal pills and hormonal injections which will decrease the number of menstrual cycles, thereby decreasing the buildup of the abnormal tissue which occurs in extrauterine sites. And the hallmark for the treatment of endometriosis is laparoscopy. Laparoscopy is also used for diagnosis and for the treatment of endometriosis. So when we do a laparoscopy, we do identify where all the lesions of endometriosis are present. In case it is present in the ovary as an endometriotic cyst, the cyst is removed, which is called as laparoscopic endometriotic cystectomy. The lesions over the uterus, over the peritoneal surfaces are all fulgurated. The adhesions which are present are released. So when the adhesions are released, the normal tubo-ovarian relationship is restored, so which will help in fertility. Post surgery, the patients are again put on hormonal treatment to decrease the buildup of the endometrial tissue which are present in the extrauterine sites. Following surgery, the patients of endometriosis require a follow-up.